Crohn's disease is an inflammatory bowel disease. It may involve any portion of the gastrointestinal tract, from the oral cavity to the perianal area. Age of onset is usually between 15 and 30 years. Risk factors are genetic factors, smoking, dietary fat and low vitamin D intake. Stress may have a role in symptoms exacerbation. Symptoms include abdominal pain, diarrhea, and fatigue. Bowel inflammation is associated with sinus tracts that may lead to fistulas and abscesses. Perianal disease is common in about 1/3 of patients. Diarrhea can lead to malabsorption and malnutrition, including vitamin deficiency and hypocalcemia, low calcium levels, which can result in bone disease. Patients may have extraintestinal manifestations, conditions that occur outside the gastrointestinal tract. These are related to disease activity and include arthritis, the most common extraintestinal manifestation. Approximately 20% of patients. Eye involvement, approximately 5% of patients. Skin disorders, approximately 10% of patients. Primary sclerosing cholangitis, a complicated chronic liver disease. Approximately 5% of patients. Diagnosis is based on imaging, MRI, endoscopic, and histologic findings. Laboratory blood tests may reveal inflammatory markers such as elevated C-reactive protein. Fecal calprotectin is a marker for inflammation in the gastrointestinal tract and is useful for the differentiation of inflammatory bowel disease from irritable bowel syndrome. Treatment in mild cases is based on glucocorticoids or sulfasalazine, azulfidine. More severe cases are treated with azathioprine, Imuran, or anti-TNF agents such as ustekinumab, Stelara, vedolizumab, Entyvio. Risankizumab, Skyrizi, or upadacitinib, Rinvoq, which is the first oral medication to treat moderate to severe Crohn's disease. Lactose avoidance in cases of lactose intolerance. Multivitamin and nutritional supplements in cases of malnutrition. Elimination diets in cases where patients associate certain types of foods with development of symptoms. It is recommended to limit intake of processed food and artificial sweeteners while avoiding trans fatty acids. Patients with complications or severe inflammation refractory to medical therapy may require surgical resection of a bowel segment. Worth noting is that surgery does not cure Crohn's disease, as the disease can recur in any portion of the gastrointestinal tract. Many patients have chronic and intermittent symptoms, but some may have a continuous and progressive disease. There is an elevated risk of colorectal cancer in long-standing disease involving the colon, so regular follow-up is recommended. Want to know more? Watch my channel.